The download-thon continues, Guam right here, and we have another advocate of someone saying why you should run the Guam COVID Alert app. A good friend of our program here on KUAM, Dr. Michael a pediatrician, a COVID survivor, as well as a member of the Physicians Advisory Group. Doc, good to see you as always, and we're glad to have you here.
Hey, thanks for having me on, Jason.
All right, so as I was saying, you have an intimate level of knowledge of COVID on multiple dimensions. The patients that you see and that you treat are by their nature young people, and in some cases very, very young people. And this is a demographic that apps are basically their way of communicating and everything. So it's very, very effective in that regard. Have you had discussions about, trying to advocate for the use of the Guam COVID Alert app for your patients, as well as, the parents of your patients and the entire family unit?
Oh, absolutely. This app is going to be such a great tool for us to really help with the contact tracing. So patients that come in, we always have a little talk about COVID. The patients that we test, thankfully, a lot of them are negative, but I always tell them, please download this app. As a lot of the viewers may know, I myself had COVID. I was really fortunate in that the friend that I was exposed to knew that he was exposed and then was able to tell me when he tested positive. But, as things start opening up, thankfully, businesses are starting to open up again and people start moving around. We might not have that luxury of knowing exactly where our exposure was. And so that's where this app comes in so handy. Just put it in your pocket, turn it on. And if you're next to somebody for 15 minutes or longer, it's just going to ping you if that person ends up being positive. And of course, they put in that code. So,
I love that story that you tell, and you've shared it with us many, many times, which we greatly appreciate. As you said, you actually had a good friend who was privileged enough to actually have the information and the knowledge that, he or she was positive, shared that with you, and then that kind of set off the events. But yeah, with this app, everything is automated, it's reliable. Your identity is not given out. So like it allays a lot of the concerns that people are having right now. Maybe from the flip side of the coin, what's some of the pushback, some of the concerns that your patients, your people you talk to every day as a physician are saying?
I'll be honest, most of my patients don't give any pushback. They find out and they're like, oh, you know what, this is a good idea. I heard about it and I was meaning to download it. I just hadn't gone around to actually doing it. And so it does take a few minutes. It's by no means a difficult process, but you just have to go and do it. And, it's just one more thing to add on to your day, right?
I just thought about that. In your case, is it the youngsters advocating to their parents and telling their parents, hey, we have to do this. This is great for our community. It's great for our island. Or is it kind of like the other way where it's the parents saying, okay, I know you guys are spending all day on Instagram and on Snapchat and everything, but run this too? It's
actually definitely more the parents that are concerned, right? With any parent that comes into a clinic to get their kids seen, is because they have a concern for their child's well-being, right? And so, of course, they're going to be the ones that are concerned. And a lot of parents have been doing a really good job of kind of protecting the kids from, how bad COVID can really be. But the parents know, and the parents are interested.
Mm-hmm. And on a more macro level, of course, you are a pediatrician. You're an expert in the treatment of young patients. But with your physicians throughout the different medical disciplines and everything like that, I know all physicians I've talked to are, saying, hey, everybody, we have to run this app because it helps our community. We're trying to work as hard as we can and stay safe and stay healthy so that we can help you. But, you have to help us too.
Absolutely. This is just going to be a huge asset to helping with the contact tracing. I think they mentioned that every person that downloads it can potentially prevent another infection. And if we have a fatality rate of a little bit of 1%, if 100 people download this, we can potentially save a life with every 100 people.
Mm-hmm. Okay, now as someone who has actually been through COVID, like firsthand and everything like that, I'm sure, you've got probably a lot of stories that you wouldn't reveal here, but you can probably intimate to, your patients and everything about it is critically important. And, the rate of infection is, all you have to do is just spend a few moments, a few minutes next to somebody who has it, and you can very easily catch it.
Yeah, I was really surprised when I turned positive. Even though I knew my friend had been exposed, we were sitting a few feet away. I wasn't talking to him directly. We didn't touch. Our big mistake was nobody had symptoms, so nobody was wearing masks. And so it's really that simple. So yeah, just be on your guard, keep your guard up, and don't take it for granted.
All right. So, Dr. We thank you for your time. Once again, we thank you for the wisdom that you've provided. And, we thank you for helping us hopefully get to that 2/3 of our population mark, because we are shooting to get as close as we can to 75,000 installs. It's a very doable goal, and we know we're going to get this done with the help of people like yourself. So thank you very much.
Hey, my pleasure. Please download the app.
There you go. Any thoughts? And I'll give you the final say. Any thoughts in closing about, why it's important that people do this, or, anything else you'd like to add?
I really like to push upon people, besides doing the app, it's not going to protect you from COVID. So please keep wearing your mask. Please keep washing your hands. And please this year, please get your flu shot so you don't have to deal with two things at the same time.
That's a great point to be made. So Dr. Michael from One Love Pediatrics, thank you so much. And we'll talk to you very soon.
All right. Thanks, Jason.
All right.